This is the Collaborative Stage Data Collection System, CS Moments. The topic for today is prostate site-specific factor 12, coding the number of cores positive. I'm Donna Gress, AJCC Technical Specialist. Now the question is, how do you code the number of prostate cores positive? The patient had a prostate needle biopsy on January 3rd. The pathology report showed adenocarcinoma. The number of cores positive was 8, and the total number of cores examined was 12. On January 20th, the pathology report said the number of cores positive was 6, and the total number of cores was 20. So the patient, during the course of his initial workup, had 2 separate prostatic biopsy procedures. Given the information presented, how would you code the collaborative stage site-specific factor 12, prostate cores positive? The answer would be coded 008. Use the pathology report as your source document for coding the number of cores positive. The number of locations biopsied is not necessarily the same as the number of cores positive, and fragments are not the same as cores. Look for specific information documented by the pathologist. Look for a statement or comment that says the number of cores positive or the cores positive followed by a number listed. A patient may have multiple procedures performed. Do not add information together from multiple procedures. Instead, identify the procedure that documents the most number of positive cores and use that particular pathology report for coding the number of cores positive. Now, in this scenario, the patient had a transperineal template-guided saturation biopsy. The number of cores positive was 72, and the total number of cores was 80. Now, the transperineal template-guided saturation biopsy is a stereotactic prostate biopsy procedure technique that generally produces around 30 to 80 core biopsies. This alternative biopsy technique is sometimes used for high-risk patients, such as those with persistently elevated PSA, those with atypia on previous prostate biopsies, or for men whose biopsies show high-grade prostatic intraepithelial neoplasia. So how is site-specific factor 12 coded for this case? The answer is 072. When documenting site-specific factor 12, use a 3-digit number to document the actual number of cores positive specified on the pathology report. Use leading zeros when there are less than 100 cores positive. More information can be found in the collaborative stage version 0205 coding instructions under prostate site-specific factor 12. Please be sure to post your questions to the Cancer Forum, the Collaborative Stage Forum specifically. This will provide not only an answer for you, but information for everyone so that everyone can read your questions and answers. This also allows us to track the questions asked for educational purposes and decide the topics for our next educational videos. Be sure and check out the YouTube channel, the AJCC channel. These are short videos on important concepts for both AJCC and Collaborative Stage. Also, the Collaborative Stage videos are also posted on the web page to make sure that you have easy access to them. This has been sponsored by the Collaborative Stage version 2 Education and Training Team and AJCC, the administrative sponsor of Collaborative Stage. Thank you.